Last week, we began the discussion about coronary artery disease. Let me refresh your memory with regards to what it looks like. So, as you look on the left, this is what we're trying to avoid. This is bad news. So now that we know what coronary artery disease is, let's find out if you are at risk. Well, here are the risk factors. Getting older. Number 2, one's sex. Men are typically at a greater risk. However, the risk for women goes up after menopause. Number 3, a family history of heart disease, especially if your father or brother was diagnosed with heart disease before age 55, or if your mother or sister was diagnosed before age 65. Number 4, smoking is a huge risk factor, and being exposed to secondhand smoke also puts you at risk. Number 5, high blood pressure. Number 6, high total blood cholesterol, a high level of LDL cholesterol, also known as the bad cholesterol, or a low level of HDL cholesterol, known as the good cholesterol. Number 7, diabetes. Number 8, being overweight or obese. Number 9, lack of exercise. Number 10, constant stress. Number 11, being of African American, Mexican American, Native American, Native Hawaiian, or Asian American descent. Number 12, did you know that racism fuels hypertension? Several studies have been done that have shown racism fuels high blood pressure in African American people. Blacks who endure life-altering instances of discrimination are a third to 1/2 times more likely to develop high blood pressure than those who have not been similarly traumatized. This was reported by the Journal of Hypertension in July of 2020. Number 13, eating an unhealthy diet consisting of foods with high levels of saturated fat, trans fat, salt, and sugar, which is unfortunately characteristic of the typical American diet. Risk factors frequently occur together, and one may activate another. And the more risk factors you have, the greater your likelihood of developing coronary artery disease. Now I want to switch gears and touch upon some less commonly known risk factors. Number 1, sleep apnea. Number 2, high levels of certain blood tests, including CRP or C-reactive protein, triglycerides, and homocysteine. Number 3, preeclampsia. This condition can develop in women during pregnancy, causing high blood pressure. It can result in a higher risk of heart disease later on in life. Number 4, increased alcohol consumption. And lastly, number 5, people who have an autoimmune disorder such as rheumatoid arthritis and lupus. Well, that's it for today. Join me next week. We will look at the symptoms of coronary artery disease.